broadcast is now starting. All attendees are in listen-only mode.
Okay, so just want to confirm that it's okay to get started, Dave?
Yeah, you can go ahead. Start whenever you're ready.
Okay. Good afternoon, everyone. I'm glad you could join us. Today's presentation is on public health and risk communication for brownfield sites as part of the Technical Assistance for Brownfields program. Just as a reminder, this presentation is being recorded, and the recording and the slides will be available on the TAB website. The presentation should take about 30 minutes, and we have about 15 minutes for questions and answers. During the presentation, you're welcome to put your questions or any comments in the questions box on the control panel. My name is Sarah Wakai, and I'm an assistant professor at UConn Health, Center for Population Health. I'd like to acknowledge the project leadership. Dr. Crisocco is the TAB program director, and Dr. Pompotti is the program manager. And Dave Dixon is also part of the team and is on the online with us today as well. The objectives for this presentation include a definition of risk communication, the 7 cardinal rules of risk communication, a case study, and some examples and resources. Risk communication, EPA has adopted the definition of risk communication as communication intended to supply audience members with the information they need to make informed, independent judgments about risks to health, safety, and the environment. As you probably know, risk communication is a huge field. Covella and Allen synthesized much of the risk communication information out there into the 7 cardinal rules. As you will see, some of the rules seem obvious and some of them overlap a bit, but it is a helpful and widely used guide for preparing risk communication messages. The rules have been adopted somewhat here for the current presentation. Rule 1, accept and involve the public as a legitimate partner. Rule 1 begins with the premise that people and communities have a right to participate in decisions that affect their lives, their property, and the things they value. An important step to achieve this is to involve the community early, before important decisions are made. There are numerous ways to communicate or interact with the public. Some of the more traditional approaches rely on what is often referred to as a deficit model. This approach assumes that the audience does not know much about the topic and that the speaker is a sole expert. The emphasis is on doing things to the community or for the community. Asset models recognize that community members have knowledge and expertise to share, and that they have a right to participate in decisions that affect them. This approach emphasizes decision-making with the community or by the community. For Rule 2 is plan carefully and evaluate your efforts. You'll want to develop clear risk communication messages, which we'll have some examples in a little bit, and pre-test your messages, for example, in a focus group, and then train staff in communication skills. On any given day, we often experience information overload. So mental noise theory postulates that when people are stressed or upset, as they might be when learning about environmental risks in their neighborhood, they may have some difficulty hearing, understanding, or remembering information. Providing short, simple messages with important information may help to overcome this challenge. You've probably noticed that many memorable messages or advertising slogans are often just 2 or 3 words. So in terms of risk communication, we have the, reduce, reuse, recycle, or 3 tests before age 3, boil water advisory, things that are just very simple and memorable. For Rule 3, you'll want to listen to the public specific concerns. So learn what people know what they think and what they want to be done. You'll want to get to know your specific audience. Some of these things may seem obvious, but consider them as they relate to environmental justice. So think of the demographics, so the age of the participants. Do they have young children? Are they senior citizens? What's their cultural background, the educational level, the geographic location? And keep in mind that individuals who live within a mile of a brownfield site are more likely to be Black, Indigenous, and people of color, low income, non-English speakers, and less likely to have a high school education than the general US population. They may also have additional stressors such as health issues, financial burdens, and additive stressors. So additive stressors are those that when combined have a greater impact than any of the stressors individually. They also may be prolonged, generational, historic, and institutionalized. You can use a variety of ways to get to know your audience, such as surveys, interviews, focus groups, and town halls. EPA provides this resource of do's and don'ts about listening skills, and it's a good reference that you can take a look at in greater detail on your own later. In general, be aware of your own listening habits. Pay attention to the speaker, and remember that gestures, posture, and other body language behaviors often override verbal communication. In fact, only 7% of what we communicate is based on the words we say. 60% of communication has to do with facial expression and body language. And I have to admit, this might be a bit tricky these days with our reliance on digital communication. Effective risk communication is based on an understanding that risk means different things to different people. Risk perception is based on emotions, facts, experience, and uncertainty. There's a clear distinction between objective risk and subjective risk. Let's take a closer look at that now. So risk communication, when professionals say risk communication, we're thinking of probability. So risk is measured at the population level. What percent of the population is impacted by that? When others hear the term risk, they think danger. So risk is understood at the individual level. Will this hurt me or not? But keep in mind, when speaking with the public, that some experts in the field of risk communication recommend against using the term safe, since few things are safe for everyone and can be used without any precaution at all. People's perception of risk is often influenced by things other than numerical data. There are certain things that may reduce or increase perception of risk. For example, having control of the situation, such as driving a car, is perceived as less risky than flying in an airplane where someone else has control. If something is beneficial, such as being exposed to radiation for a dental X-ray, it may have a lower level of perceived risk. Be honest, frank, and open. So you'll want to introduce yourself and don't go in there expecting that the public will trust you immediately. And if you don't have an answer to a question, it's fine to say so. And just share risk information as soon as possible. An important first step in preparing risk communication messages is building trust with the audience. There are many factors that contribute to trust. Most have to do with caring and empathy, competence and expertise, honesty and openness, and dedication and commitment. Work with other credible sources. So you'll want to determine who's best able to answer questions about risk by working with others, develop partnerships, and issue joint communications. In general, health professionals, scientists, educators, and advisory groups have high credibility and promote trust on health, safety, and environmental issues. Media and activist groups have medium credibility. Industry and paid consultants have low credibility with the public. This is just an example of a collaborative effort with public agencies, businesses, and community groups during the development development of the Reviviendo Gateway Initiative in Massachusetts. Meet the needs of the media. The media, keep in mind that the media are prime transmitters of information on risks to the public. You can prepare a very limited number of key messages and be open with and accessible to the media, and say only what you're willing to be repeated. And keep in mind, oops, I just want to go back to the media. Keep in mind that some organizations have communication spokespersons department, training or protocol. So you may want to check with your organization before you speak directly with the media. Speak clearly and with compassion. Use simple language and avoid jargon. You want to be sensitive to local norms and promise only what you can do and do what you promise. Documents should be written in a way so that the public can find what they need, understand what they find, and use what they find to meet their needs. Here are some examples of simplified terminology. Instead of using the term disease, you may want to use the term sickness or illness. And instead of dose, you can use amount or number of times. When researchers use the term surveillance, we are thinking of collecting data at a population level, which is de-identified. When the general population hears the term surveillance, they think of an invasion of privacy or espionage, big brother, or tracking. So that's a term that you may want to consider avoiding and using terms such as collecting or gathering of information. Now, let me walk you through a risk communication message maps case study. So EPA's Risk Communication and Action publication contains detailed steps to create your message. This basically summarizes the 7 cardinal rules, starting with identifying stakeholders and moving through developing key messages and delivery of these messages. To develop your key messages, you may want to use this message map template. Here you can start with your stakeholders' questions or concerns to create 3 short key messages. Each message can have a few supporting sub-messages. Let's take a look at a case study from ATSDR document. So this was a case study that occurred right here in East Hampton, Connecticut. Citco Incorporated was a former plastics safety net manufacturing facility based here in Connecticut, and it was redeveloped into a daycare center. The site soil had historically contained high levels of arsenic, a naturally occurring element that's used in wood preservation or pesticides, as well as other contaminants. Although much of the site had been cleaned up, the soil in the playground was never sampled to determine whether it contained levels of arsenic harmful to children who attended the daycare. In February 2008, Connecticut State Department of Public Health worked with a daycare property owner to test the soil, and it was determined that while the playground surface and subsurface was contaminated with arsenic, they were able to develop a remedial plan to prevent exposure. The state worked with the property owner to ensure arsenic in the soil would be covered with wood chips to prevent exposure. And DPH developed a fact sheet and held a public meeting to provide information and answer questions. During the meeting, the message to parents and staff was that children had not likely had direct contact with the contaminant in the soil in the playground prior to the cleanup and were thus not exposed to arsenic in the soil and were not at risk of direct contact in the future. So this is the message map. I'm not sure if you folks can read this because I know it's fairly dense, but so they developed 4, even though I know the template had 3, and the template did kind of restrict or recommend using a maximum of 9 words, and these look a little bit more lengthy. but besides those kind of mechanical differences, basically the four messages were that DP8 had worked with the owner and operator to ensure that the soil was covered with wood chips. Children attending would not have direct contact with it, with any contaminated soil, and children were not likely exposed to anything because it was winter when they in the prior to the remediation. And then the fourth message was the lack of contact with the soil means children will not be exposed to arsenic in the soil. And then they had the supporting sub messages there. So if possible, I wanted to ask you, where do you go to find out about public health or environmental safety information? What type of resources do you go to? You want to kind of type those in the question box if possible. Okay, well, I'll go ahead and let you know what I think on this. So there are several ways to get the message out to the community. They can be written, spoken, visual, paper, digital, in person, or virtual. As you know, the communication landscape has transformed dramatically in the past few decades. In addition to the traditional print, radio, and television media, there are many online resources available and many more than the examples given here. But it's important to ask and learn which media will be most effective in reaching your audience. For example, if community members near your brownfield are frequent readers of the local paper, then that would be a good source to disseminate the information. If there are high users of social media, then you can go that route. But make sure your message aligns with the platform you choose and think about who will see the message. And keep in mind preferred language, education level, color blindness, visual or hearing disabilities, emotional reaction, and consider the source. So I'm going to show you several examples and walk you through some of their features. Each of the materials has a link so you can visit the site if you'd like to take a closer look on your own. As you review the documents, you may want to consider how your perception, or perhaps that of the agency that's created the document, interacts with the perception of the potential audience. And you may want to start thinking in terms of what demographic group do you think this would work well for? How do you think this should be shared with the public or disseminated to the public? And what modifications would you make to this example to make it suitable for your audience? So this is a billboard promoting anti-littering in waterways. Since some folks consume, they eat the fish that they catch and potentially eat any contaminants as well. This is a fact sheet on environmental contaminants. It shows, I think this is a nice way to kind of illustrate that, lead is the most frequently found contaminant in brownfields. And so it has kind of like the bigger and darker circle. And it lists things if you wanted things to be in text. And then on the back, it kind of shows pathways to exposure and some potential health effects. This is the same fact sheet, but it's in Spanish. So I just wanted to point out that most of the materials from federal and some of the state agencies are available for dissemination in multiple languages. And here's a fact sheet. Again, thinking that this is somewhat text-based, but again, it has 3 facts on the front, 3 facts on the back. Even though it's text-based, it's kind of, it has a limited amount of information. The information is important, but it's also kind of digestible. This one you can see it's much more text-based, and this is actually, it's a very good fact sheet. But it is going to be a little bit more on the text-based, and it does have on the back, it has links so that if somebody wanted more information, they would be able to access that. And this one, oh, here we go. And here's an example of an infographic. So infographics are very eye-catching and combine images and colors to send a message. They also aim to simplify complicated concepts and highlight specific trends or details. Keep in mind that infographics can take time and expertise to prepare, and because they are simplified, the information may be misinterpreted. This particular infographic focuses on the harm lead can cause and what not to do. Perhaps a more helpful approach might be to suggest ways to improve health and safety. Here's another link to a infographic. And here's an infographic, and WHO does some nice work on their infographics. This one, you may want to see that this one does not have any, it might be better if there was a link to more information or to a QR code. It's a little animation there. Oh, lots of animation there. This graph, just some folks I happen to like graphs, not everybody does, but this one, what's nice about this is that you can, it compares race and ethnicity over time. So if someone wanted something that was a little more data driven, this would be a good way to show information. This is an example of indexing and color coding. The top table shows the color code, levels of concern, index values, and a description of air quality. And the bottom scale illustrates the same information in somewhat more simplified and visual format. And deciding which one to use would depend on your audience and available space, etc. Index is a way to express data as part of a scale. And here are a scale of level of concern ranging from good to hazardous. And you'll want to use appropriate color schemes that will enhance a viewer's understanding. For example, if you're trying to communicate a heat index, you may want to use a thermometer as a graphic with a range from blue to red. But keep in mind that some individuals may be colorblind, so color coding may not be helpful and color printing may not be available or too resource intensive for some groups. This is just a mapping and color coding. This is from a interactive dashboard from CDC. And here's an example of a diagram that just shows waste disposal site, just the groundwater and a waste disposal site. And then this is just a social media. This is EPA's Twitter feed. Here's an example of EPA social media, their Facebook page, a podcast from EPA. And here are some videos. And this, this is a really good resource if you're interested in hosting a stakeholder forum. Stakeholder forums have been shown to be effective ways to hear from community members and share information. The document provides guidance on establishing goals and objectives, developing an agenda, identifying and inviting participants, even how to set up the room, and some kind of activities you can use. So if you're thinking of sharing your information through a stakeholders forum, this would be a good resource to take a look at. And then this is just to let you know that the recording of the presentation will be uploaded to the TAB website under the workshops and webinars. So that's it for the presentation. Does anyone have any questions or any comments?
For folks listening, there is a question box on your control panel. So if you do have a question for Sarah, you can type it into that question box. I don't see any questions at the moment, but we can hold on another 30 seconds here in case somebody is typing one in. I don't see it when somebody's starting to type. So we will just hold on a second here and see if anyone wants to type one in.
Okay, sounds good.
Okay, well, not seeing any questions. I think we are good to wrap it up for today. I think that was a great presentation, Sarah, so thank you. I learned a lot about different things. Communication in general, I learned a lot about, so that was a great presentation, so thank you.
Great. All righty. Well, thank you. Take care.
Have a good day, everybody.
All righty. Bye-bye.